Welcome back to the show, everyone. You know, we're going to talk about some things in the next little while that may be a little gross to people who have never experienced it, but for people that do, revolutionary, some of the treatments that we're talking about here.
Absolutely, one of those being toe fungus. Dr. Rivers, you've met him on the show before. Pacific Dermaesthetics is the name of his company. How are you, Dr. Rivers?
Nice to see you.
I'm well. Thanks for having me back.
Good. So we're talking about the whole gamut today. Now, toe fungus is not a pleasant conversation, nor is it a pleasant thing to have. Before we get to the pictures, tell us, you know, a lot of people think dirty feet causes toe fungus, but what actually causes it?
Well, fungus is caused by a living organism that grows either in the skin or in the nails. And interestingly, it's very common for people over the age of 60, for example, older people, about 20% of the population, but it can start when you're a baby. Literally.
Well, this blew me away, and there was the one stat in the package that said that in your lifetime, 50% of people will you know, have this come into their lives, potentially on one of their nail beds.
Right, and it starts off, you can have it as athlete's foot, and then it gets into the nails, and then it sort of hops from one nail to the other.
And what happens if you don't treat it? Does it get worse? Does it get terribly bad?
Well, it's variable, but the thing is that...
There's the money shot.
Certainly what happens is that the nail becomes very discolored, it can become thickened, it can crack and literally fall off.
Ouch.
And the main issue, it's not so much painful, but it's really cosmetically inelegant.
Unappealing, yeah.
You wouldn't be wearing sandals this season.
And traditionally, it's been quite difficult to treat, isn't it? I mean, you know, there's been a variety of methods been used to
People
sort of
have tried topical treatments which don't work very well. There's the success rate's about 20% at most. Oral medications can work better, maybe 40, 50% at tops, but even with that, you can have side effects, liver damage, affects your blood.
Yeah.
So what can you do? What is revolutionary in the world of toe fungus?
Nail polish, no. The new thing is that we have a laser. It's by a company called Cutera. It's called the Genesis laser, and it is a laser that seems to kill the fungus as you pass the laser light over it.
Wow.
It's really quite interesting. It's sort of new science. It's not really clear exactly how it's working.
Yeah.
But it seems
to have...
working. But it's working.
And you're not ingesting anything? You're not...
Nothing.
And what's the sort of rate of recovery from it? Like, does it make your nail better? Or does the nail have to grow out?
Well, it's interesting that you asked that, because what happens is that with pills, you have to see the nail plate grow out, and it takes sometimes up to a year for a toenail to grow out, for example. But with this, we see changes within about 4 to 5 weeks, and it seems that the laser light is killing the fungus as it hits the fungus. Yeah. And so the nail seems to normalize relatively quickly. The treatments are variable, though. It's, you know, a few treatments up to maybe 5 treatments.
Right. But to get that relief, that's amazing. Now let's move on to spring's around the corner. You know, bikini season, laser hair removal. It seems like lasers are, you know, they're getting better and better all the time. What's new in the world of hair removal?
Well, I've been working with lasers for almost 20 years, more than 20 years, and started doing some preliminary studies on hair removal back in '96. And the laser we had then was what's called a long pulse ruby laser, and we'd get like 1 pulse a second, and it was.
And what are we looking at here?
Well, this is the new version. This is the Light Shear Duet. This is probably the gold standard of laser hair removal. And what's interesting about it is it's much faster than older lasers. It's almost painless for most parts.
And for people who've had it done before, painless is amazing.
A vacuum gently, does that make a difference in pain or in efficacy?
Both. What happens is the vacuum sucks the skin up a little bit, which distracts you in terms of the pain aspect. It also brings the hair follicles closer to the skin surface, which makes the laser more capable of destroying the hairs, so you can use less energy, so it's less painful. Nice. Because you're blanching blood vessels and stretching out the pigment cells, you're potentially minimizing collateral damage, so people with darker skin can do this as well. Nice. So it's a really
let's look at some before and after pictures.
Before and after pictures.
Because it's amazing.
Because people usually associate this particular treatment with pain, it takes a lot of that out of it, but this is also quite a bit faster, isn't it?
Yeah, I mean, you can literally do both your armpits in about 5 minutes. You can do a back in 20 minutes.
This is my back before and no, it's not. Mine's just the one on the left.
How many treatments do you have to do for something like that?
On average, about 5.
Really? And how long would you be like lying down and sort of getting it done?
Well, as I'm saying, to do your back, it's maybe about 20 minutes or so.
Really? As compared to what before the...
Hours.
Hours.
Hours of elastic bands.
20 minutes, yeah.
Feeling
20
like
minutes,
they're flicking at
20
you.
minutes and no pain seems like a little bit of a better option.
Liposonics is something that people keep hearing about. They wonder what it is. It is not liposuction. Maybe you can explain what this treatment is.
Well, the latest trend, if you will, in aesthetic medicine is body contouring. So where you can have pockets of fat that you just can't get rid of. You go to the gym all the time, you're left with small areas. And this is very useful in helping to reduce those. What this device does, it uses high-intensity focused ultrasound. So ultrasound waves literally pass through the skin, and they're focused about 1.3 centimeters below the skin surface, and they literally make holes in the fat.
And we're not talking about people that are overweight. We're talking about people, as you mentioned, can't get rid of that last little maybe 5 pounds.
Yeah, the love handles, the central thumb.
Everybody's got a little, I mean, it's funny because everybody's got a little pocket, right? Everybody's got.
And one of our Shaw staffers, who shall remain nameless, was brave enough to go in, and this is her getting the treatment by you. Maybe you can explain what she had done and what she can expect.
We need to keep it very general, Fiona. Her or him getting this treatment. So.
Right. Basically, what we do is we assess the individual to see how much fat they have, where the fat is, and we have to have a minimum of about 2.5 centimeters of fat that we can pinch, so the laser can work on the ultrasound can work on it, and then I mark off the area where I want to have the treatment done, and we put numbers on it so that we know which sites we're doing, and then we put the device over each of those sites. It's about a minute for each pulse. And we do about a series of 3 of those.
Painful?
Yeah, pain.
It's variable. Some spots are not very painful at all. Some are real zingers.
Right, it can leave a little bit of bruising and stuff.
You can get bruising, which can last a week to 10 days. You can have tenderness up to a couple of weeks, but we encourage people to exercise right after that.
Yeah.
Our Shaw staffer said that, you know, it depends on the person, but she said her pain was pretty minimal, which I guess is a good thing.
Pretty minimal.
So what?
She said.
If she's getting results, so what can you expect? How can you keep the results if you get them?
Well, I mean, the removal of the fat itself seems to be permanent, but you have to consider this as part of a 3-pronged approach to fat, and that means you have to keep on exercising, you have to watch what you're eating, and hope for the best.
So exercise and a healthy diet. You slave driver!
If you want to find out more, you can go to Dr. Rivers' website to find about these treatments, and well, there's a whole a bunch of others that are listed on the website for you. Thank you so much.
Thank
Pleasure.
you.
Thanks for
Appreciate
having
it.
me back.
How was the toenail? Yeah, you liked it? That's good. Fiona was a little worried about that. She thought that was kind of gross. I don't think it was a big deal.
Kind of gross.
Well, I only have it on 3 out of 5.
We're going to take a break.